although I am not a doctor, I'm just a nurse. But what we saw on these front lines, we knew what was happening. And when we asked for the ibuprofen, they said, no, it was contraindicated. When we asked, like, why aren't we giving them steroids? Oh, well, it's not. We're just following orders. Following orders has led to the sheer number of deaths that has occurred in these hospitals. I didn't see a single patient died of COVID. I've seen a substantial number of patients die of negligence and medical malfeasance. When I was on the front lines of New York, I'm unfortunately known globally viral as the nurse that was in the break room sobbing, saying that they were murdering my patients. The pharmaceutical companies had gone into those hospitals and decided to practice, I guess you can say, on the minorities, on the disadvantaged, on the marginalized populations that we know that we had no advocates for, because the very agencies that should have been protecting them were closed because we were sheltering in place. Now, while I was there and I saw that the pharmaceutical companies were rolling out Remdesivir onto the patients, I tried to get a hold of the ARBs. I tried to get a hold of my appropriate chain of command. I tried CMS. I tried Department of Health. And they rolled out Remdesivir onto a substantial number of patients for which we all saw it was killing the patients. And now it's the FDA-approved drug that is continuing to kill patients in the United States. As nurses, we've collected a statistical or descriptive amount of information that you may not get from the doctors, because for more they do quantitative data, we do qualitative data with a humanistic, phenomenological approach in nursing research. And so we've collected the data from all of these patients across the country from which we have been helping patients, because I formed the organization American Frontline Nurses and the Advocacy Network so nurses could advocate for these patients. And all of this data pool shows that as these patients get Remdesivir, they have a less than 25% chance of survival if they get more than 2 doses.